the right treatment on right time. It is my utmost pleasure to introduce Dr. Krishnamani, an expert in the field of medical oncology with an illustrious career spanning more than 10 years. Dr. Krishnamani has consistently demonstrated a commitment to advancing in cancer treatment. Please join me in welcoming Dr. Krishnamani to our live session called Breaking the News. Welcome, Doctor. Welcome a lot.
Hello, everyone. Thank you. Welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And today's topic is on breaking the news. So we have deliberately not put it as breaking the bad news. Let's not go into the negative psyche that it's a bad news. It's a news and it has to be broken. How do we break it? Whom do we tell it? What's the way of telling that? And is there any model which is already there, which is better to follow? How many of us follow this? And one important thing which I was just discussing with you also, even before we started the session, is the communication part is not given of so much importance even when we are in medical school. So when somebody is affected with cancer, you have to break the news to them. And this is not a part of your regular curriculum. What is a part of your regular curriculum? What is cancer? How does it spread? What are the stages, treatments, blah, 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 etc. So there's a lot of explosive information on this. You can get thousands of tons of information on breast cancer, lung cancer, and types, treatments, latest advances, immunotherapy, surgery, etc. But see, these are some of the small issues, but they're actually pretty big. The nitty-gritty ones like mental health and cancer, how do you cope with the diagnosis of cancer, how you break the news to the patient or the family. So that is why we want to address these in our cancer reach, so that it is like, uh, I think where the patients and the families, they feel, they feel that they are taken into confidence. So that's the whole point.
Thank you, Doctor. As you rightly said, communication, that word itself plays a very important role in every part of the life. And yes, we can get n number of information. Even in the Google, also breaking the news can be very difficult to find it out. So, Doctor, if we come like, what exactly is what breaking the news, you can say?
See, so I'll just give you an example now. The other day we had a gentleman who came in to our OPD. So he has a lump in the tummy.
Mm.
So he had a scan outside, and the scan was showing a lump, a big lump, almost 10 centimeter mass. So they did a CT scan and they said it looks like cancer. So he comes to my OPD with close to 4 or 5 relatives. And the minute the radiologist has said that you have cancer or probable cancer, and now you go and meet a cancer specialist, that's all. Hell has broken loose. So that guy is swollen, his eyes are completely red, anytime ready to crack. His spouse is crying, his parents are crying. And they say he has no habits, he's a young guy, he has a small kid. Why this? So even before they know the diagnosis or we know whether he has cancer or not, the uh, what do you say? The mental agony has started. Why me? I don't do anything. I have no habits. What will happen if I get cancer? What about my family? So this is a very common scenario you will see. So now here, what's your job? First, the job of a medical professional here is scientifically and medically prove or disprove whether you have got cancer. I cannot look at your scan and say, yes, yes, you have stomach cancer. No, scan is a photograph. I need to do a biopsy. The next question, our minds immediately start. Sir, if you put a needle, the cells will spread. So these are all myths. You have to correct those myths, state the facts, go by evidence, go by the due process, what you call guidelines. Then you will probably ask for additional tests. And then you get a diagnosis after 4 years. Now 4 days. And then the tension starts. Doctor, in 4 days, what will happen? Why doesn't the report come tomorrow? If I have to wait for 4 days, if my cancer will spread. So You have to give accurate information, scientific information, trustworthy information, reliable information, and information which is, what do you say, standard anywhere in the world. You cannot say you will do biopsy in India, but the
Hmm.
same patient with the same disease goes to maybe in America or in Australia. It should not be that biopsy is not required. So, what I'm trying to say is your recommendation should have a standard implication. It should be standard which is followed anywhere in the world. So now the onus on me is to first tell him, boss, we don't know whether you have cancer. I have to do a biopsy to prove you have cancer. So now where the breaking the news part comes. So this is the conversation which starts even before the diagnosis. So we are talking of breaking the news after the diagnosis is made, after the news of cancer has come. Before the news comes itself, somebody would have scanned you. And then from there itself, the alarm bells start ringing. For all that, sometimes people come with a lymph node, they come with cancer as a diagnosis. We do a biopsy, it comes as tuberculosis. Okay. So that's what I tell patients. God knows what this is. It could be tuberculosis. You are crying in front of me now. All your tears will be waste 4 days later if it turns out to be an infection. So don't cry. If it is cancer, okay, let us all sit and cry at that time if at all you want us to cry. So breaking the news doesn't start with the start of the news or the pathology report in your hand. It actually starts much before. It's the process which starts the minute the patient or his family comes into your consultation chamber. It starts the moment you start ordering tests. It starts the moment you say we need to prove that you have cancer or disprove that you have cancer with a biopsy or additional tests. It starts during those 4 days, or it continues during those 4 or 5 days waiting period when your biopsy is yet to come. It is very important to alienate the myths and the facts. And finally, when the news comes that somebody has a cancer or a carcinoma on a biopsy specimen, then we have to sit with him or her and then break the news. How you're going to break the news is what we are going to discuss today. Whether you're going to break it today or going to break it over a period of time, to the person or to the spouse or to the family, to all together or one after the other. So this is the whole point. So breaking the news is opening about the diagnosis and obviously the prognosis, the outcome, the treatments and the outcome and future and what the family and the patient has to expect.
So, right, doctor, in fact, it's like the way you have told, it's every hour breaking the news plays an important role for that patient, I guess, if I'm not wrong.
Correct, because the minute you say cancer, there is fear, there is a death.
Yes, yes.
Cancer is equal to death is what is a common perception. So you have to put it in such a way that you have to be correct medically, scientifically also. At the same time, your job is not to cause panic, unnecessary panic.
Yes. Because panic itself will kill the patient half.
Correct.
The cancer will play on the other half of their life. Doctor, like, do you break it all of a sudden or it's in some phase manner or
So see, it depends on person to person. It depends on session to session. And it depends that, see, all the diagnosis, you don't get it on the same day. Now, for example, today in a biopsy, I get as carcinoma. I need additional tests like IHC, immunohistochemistry, or I may need additional tests like an endoscopy or a colonoscopy. So what should I, so what do I say? I say, okay, see, we did 2 biopsies. Both of the times it was negative, but we had a strong suspicion of cancer. We did a biopsy again. Now it has come as cancer. So do I have cancer? Yes. What type of cancer? That we have to find out. It doesn't look very clear yet. I need additional tests. So don't
yes.
jump the gun. Don't immediately say, oh, so good cancer, bad cancer, surgery or chemo first. Don't go there. Take it step by step. Take it one at a time. Okay. So the way we break is we break it in a phased manner. Imagine if I give you all information now in half an hour, can you take it? And if that information is something which concerns your life and death, then it is even more difficult. Also, you have to give time for the person to understand as assimilate, recapitulate, ask questions. So this is what is called, in 2000, there was a model which was prescribed called the spikes model. S is setting, P is perception, I is information, K is knowledge, E is empathy, S is summary. So what they say, this is the way to break the news or a general guideline to break the news. So when the news of a cancer has come, that this person is suffering from cancer, remember all the information may not be available the same day. We usually try to break it down in parts because the retention power is less. We want people to understand and be free to ask questions. So now when you look at the spikes part, the first S is called setting. So you create an environment. You are not going to break the news in the corridor, okay, or where 4 or 5 people are standing around. You will call them to your consultation chamber. You will offer them a seat, make them comfortable, give them a glass of water if required, switch off your mobile phones, prevent interruptions across the door, ask your staff not to come in unless it's an emergency. So you're creating an environment because the patient also should be comfortable. If I come to your house, if you make me stand for half an hour when I come to your house, what will you first do? You'll open the door and say, please have a seat. You want some water. So this is basic courtesy, etiquette. So that is setting, creating the setting or environment where everybody feels comfortable because they also should feel comfortable to ask questions. Nobody should be scared of a doctor. It's your health. So you should have a two-way communication. It's not one-way communication. Next is perception. What's your perception? What do you want to know? What do you know? Do you know you had cancer before and it has relapsed now? Or do you think that this is the first time you have cancer, or have you come with cancer for the first time? What is the treatments you took earlier? What are your hopes and aspirations? What is your perception? What do you think about cancer, the word or the disease? I is information. What is information you have? What is the information I have? And we have to share it. K is knowledge. I have to give the knowledge regarding the cancer. I have to take, see, you had a breast lump. So if you remember 1 week back, we did a biopsy. Today that report has come, it has come as cancer. And then we did you a scan called a PET scan to look if it has spread. It has not spread anywhere. It looks like stage 2. This is all the knowledge. So you say you have got cancer in the breast. You have done a biopsy and proven it. It has not spread anywhere. Then you're talking about the stage. Then you're going to say, because it's a bit large, I'm going to give you chemotherapy to shrink it first. And then we will take for surgery. And then we will do radiation. And then we will give you hormone tablets. All this will go on for 1 year. So you're talking about prognosis, or sorry, the treatment. And then finally the prognosis. And you'll see 90-95% of the time you'll be fine. This is worldwide data, so don't worry. So you're giving hope scientifically and explaining the prognosis. And then you will say, once the treatment is over, you have to come once in 3 months, once in 6 months, and all that. So you will just broadly define it, and then you will say, see, when we come to each section, at that time we will discuss again. So now from tomorrow morning, come for your chemo. These first 4 cycles, you will come every 2 weeks. So and so medicine, so and so side effects. Tomorrow I'll explain you what all precautions to take. Finally, you are going to summarize. Breast cancer, stage 2, early stage, curable, nothing to worry. Initially chemo followed by surgery. Let's see you tomorrow for chemo. K is knowledge. E is empathy. Empathize with them.
Yes.
Okay, they may be scared. They may ask you the same question again and again. Don't brush it aside. Don't get angry. Understand that they're going through a lot. Information for me is very easy sitting on this side. If I have cancer and somebody talks, then I should understand how it feels. So empathize. Don't sympathize, empathize at least. Finally, summarize. So this is the spikes model. So you're creating a setting, you're understanding them, you're allowing them to ask you questions, you're communicating in a two-way manner, you're discussing knowledge, you're empathizing with them and summarizing and telling them in the conclusion, this is what is this.
In fact, breaking the news involves so many steps is something first time even I'm also learning. Spikes is such a beautiful word to listen. And after connecting it to breaking the news, it's the value for spikes has been more increased. So, doctor, like, what are the components in this breaking the news
So these are all the components which we discussed. So
spikes?
yeah, the spikes is the component. Let us understand we have to spend time with our patient. If I have to add a few points, the first meeting or the first few meetings when you are diagnosing somebody with cancer and formulating a treatment plan are the most important things. Once the treatment has started, if the treatment is for 1 year, once the patient is in the process, right, they will know, oh, no, 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 my doctor said hair will fall, I'll have loss of taste, vomiting sensation, nails will become dark in color, I have to come every 2 weeks, the cost will be this much. And once the chemo is stopped, the hair will restart, I have to take hormone tablets, some pain here and there. But the initial 1 2 months, you have to help them navigate. So spend maximum time in the beginning. After that, the patient also doesn't want to spend time with you. They are also like running. No, 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 my son has come to drop me. Before he goes to office, he has to pick me up and go. So they understand the cycle. They know what's going to happen. No, no, sir, I know what is going to happen. That's why today I couldn't wait for you. Fine, very good. But the first few cycles, first few interactions, spend maximum time to drive home the point. When they get out of your room, they should not have any doubts. They should not have if in their mind. They should not go on to this junk called Google and come back with questions which you have not already answered. So I don't want my patient to go to Google and come back to me for HER2 breast cancer and say, sir, you didn't tell us about a medicine called trastuzumab or pertuzumab, or you didn't tell us about nausea in chemotherapy, or you didn't say that if I have fever, I should come back to you immediately with a blood count. So these are simple things, but you have to tell them. That's our job.
Actually, doctor rightly said. It is said that for layman people, even drinking water can be little bit something which has to be told.
Hmm.
If you told when that it's a simple thing that even like fever, you have to go to rush to the doctor. These simple things, just general people tend to forget it. It just gets skipped out of their mind. So this really plays a very important role. So, doctor, while breaking the news, who should all be the part of this conversation? Who should will play a very important or major role in this
Now let us
conversation?
ask you something. Your health. There is something your health. Okay.
Yes.
Whom do you think I should talk to about the health, about your health? You, or your father, or your best friend, or your spouse, your brother, your mother?
I will prefer my father and my mother.
No, no. First, whom should I say?
Father.
Not even you.
uh, I can get panic, and I will can be the reason that I will my analysis will be stuck only listening to the word something which is dangerous. Father, at least he can analyze it and he can get with a solution kind of a thing because he
That's why this question
always.
is very tricky. See, imagine I have HIV.
Hmm.
Are you going to tell me that Krishnamani, we saw your report, you gave a blood test the other day, it has come HIV positive? Or you are going to go and tell my friend, who is my best friend who came with me to the OPD? I can sue you. I can
Yes.
sue you saying that who gave you the permission to divulge my confidential information to a third person?
Yes.
So here is the catch. If I am a patient, it is my it is about my body. You have no
Hmm.
right to tell others without my consent. Okay, if I am a major, it is. So ideally, if I have cancer, you should sit with me, you should talk to me, you should tell me, boss, we have done a few tests. Whichever way you want to say, that's an art. You will learn it over time. Okay, but you have to tell me. That is ideal. So there is a story to this, which I heard sometime when I was doing my residency. There was a young boy, it seems, who had testicular cancer, which is a very, 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 very curable cancer. Okay. He was told, hey, you have testicular cancer. but you'll be fine, don't worry. And he was told in the right way, whichever way it has to be told. But as you said, right, you are panicky, you will not be able to analyze. Probably that guy was panicky. He jumped from the roof and he committed suicide. So that's the trick here. You cannot talk law and you cannot also be inhuman. So you have to take a middle path. In India, what we commonly see is many a times, if it is for the mother, the son will first
Mm.
walk in. Sir, 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 my mother doesn't know anything. Whatever it is, after you examine her, make her sit outside. We will talk later. So now, if I have to treat her tomorrow, what am I going to say? How am I going to say? Tomorrow she can sue me.
Yes.
Okay. So you have to understand all these facts. There is no right or wrong here. You are doing it in the best interest of the patient. You don't want your patient to commit suicide, and or you don't want your patient to say, no, no, no. Even if it is stage 1 breast cancer, for example, it is curable. But the minute, suppose she is a type of patient who will say, I don't want any treatment, then what have you gained? Just because hearing the word cancer, she says no. Some people get depressed, some people say no. So it's a play. You have to play a role, you have to take them along. So in India, the family plays a key.
Mm.
We have a family system where everybody is
Yes.
together. So that's the key.
Rightly said. If just imagine, along with diagnosing the cancer, you have to diagnose the person mentality as well, like how to put the news in front of them and their family. It's quite a tough job, doctor, in fact, I should say.
So
So
that's why we
doctor,
have to
like,
strike.
sorry sir, you were saying something.
That's why we have to strike a balance there.
Yes. So is it like something, doctor, it's a one time thing, or it's like a multiple time again and again?
It has to be over a period of time. We have to go slow and we have to go steady. We have to explain them over multiple periods of time. Today, the father may come and ask you questions. Tomorrow, the spouse may come and again ask you if she was not
Yes.
part of the conversation. Then the brother-in-law may come, brother may come one day saying that I was elsewhere. I want to know what's happening. So obviously, you cannot entertain everybody, but at the same time, you want to give crisp, reliable information and candid information to everyone
Mhm.
after the consent.
In fact, doctor, is very true. Generally, what happens, no, sometimes the major person who are going to take care of that patient is not available. Somebody, just friend, is there. They can go somewhere wrong because the care for them and the care for the father will be different. Just an
True.
example.
Yeah, yeah, very much. So, and that fellow may not come again at all. So we need people who are going to be consistent with you because you're dealing with life and death.
Very true, sir.
I cannot see, also understand that all of us have limitations in time. I cannot tell you everything today for 1 hour, and tomorrow some new fellow comes and says, no, no, now you tell me everything. So that's not going to happen.
That's
But
not even possible.
it's not even possible.
Yes.
But as much as possible, including the cost part, it is better to be free and fair so that the family and the gentleman or the lady can make their proper informed decisions.
But doctor, this is even right now I'm just analyzing the patient's mentality, their family, everything. A doctor should be aware of that, if I'm not wrong. If the patient is with cancer, everybody in the family, even the doctor, should be aware of that.
So sometimes husband and wife will walk into your room. The wife will be having a
Mhm.
tumor. The husband will constantly be saying, no, no, nothing is there. Don't worry. Things will be fine. It is nothing serious. But actually things are serious. So even if I don't tell her at that minute, I tell him later, saying that you may want to motivate her. That's fine. But you don't be under the false impression that nothing is there. She's probably having a gallbladder cancer with a survival of less than 6 months, or a pancreatic cancer with a survival of less than 12 months. So tomorrow, you should not be able to blame you should not blame anyone. Number one. Number two, don't also be under the impression that everything will be fine when things are not fine. Nobody is going to say stage 1 breast cancer, you're going to die tomorrow. At the same time, nobody should also stay with stage 4 bad gallbladder cancer, you're going to live for years together. So just because, so that is because you don't want to hear the truth. I cannot force the truth upon you, but I should find ways to tell you that. If I don't tell the patient also, at least you.
Because that will create a wrong hope in the
Ah.
patient's mind.
Because see, tomorrow you are only going to be there with your spouse. You are going through that journey, that tough period. So mentally, also I should prepare you and your family. Imagine children. You have to prepare the parents. Things will be fine. A brief period, 1 year, just struggle. Blood cancers, 2 years, you have to struggle probably. The child will be fine. Try your best. Do your best. The child will miss schools. The child will miss friends. Child will lose hair. Food will be an issue. So all these things you have to tell. It is not just breaking the news that, oh, you have cancer or this is the stage. How you are going through that process is the most important.
Doctor, just a joke part of a thing. Immediately when a doctor will just say breaking the news, immediately the patient will go in a shock for with a number of reasons. Just listening to the cancer.
Yeah. So there is no point in, so it is an art. You have to tell it the way it has to be told, and each patient is different. Somebody may be in denial. Somebody may just not have an eye contact with you. Somebody may not just really accept it. Somebody may say, why me?
Anger.
So many things, so many emotions, so many people involved.
So, doctor, it's like along with the study on cancer, you have to also do the study on emotional take caring of the patient.
So this is what is more important than that, because this is what you do on a daily basis. And unfortunately, this is not taught in textbooks.
Very true. In fact, doctor, even in Google also, the word which you said spikes, even we type spikes, the Google will give n number of things, but it will never tell about the information what you have shared us today on spikes.
Also, what you should understand is that tone is also extremely important when you talk. Okay, that we get offended by tone and tenor, we say. Why do we like
Yes.
some good commentators like Harsha Bogle, Richie Bernard? The way they say, why don't we like some other people? Because it doesn't seem nice. But that's so it's an art, the tone, the tenor which you talk to someone. It is, see, I'll just give you an example. See, madam, you have cancer, you have stage 4 cancer. It's not curable. Okay, you may survive for probably 3 to 4 years. This is one way of saying. The other
Yes.
way of saying is, we've seen that, so we run a few tests, we found that you've got cancer. It's a breast cancer, but it's a good variety of breast cancer. Okay. It may not be completely curable, but for sure
Hmm.
we'll try to reduce the size of the lump you're suffering and all that. We'll prolong your life without much of a hassle. For initial period, you'll have some difficulties in the form of vomiting and all that. We'll try to overcome that. Overall, there is no immediate threat to life because she's worried. Son's wedding is there in 3 months, or she's looking for a daughter's match in the next 6 months. So the minute you say there's no life threat, be scientific and accurate, she gets a sigh of relief. Okay, I'm not dying tomorrow. The same scenario you're explaining in two different ways. That is what is important. You say stage 1 cancer, I'll give you chemo, you lose your hair, down, down, down. That's it. That minute itself, that patient will collapse in front of
Very true. Very true, doctor. Actually, this is something which is very important. In fact, nobody has given so much of concentration or nobody has given so much of observation on this kind of things and everything.
you. Yeah.
So, doctor, this was something breaking the news. I hope everybody over here has learned or they might have connected to some of the other points. Not only in cancer, I guess breaking the news should in all different situation it should be in a convincing in a proper take care way, doctor. So thank you, doctor. By this yeah, information which you have shared today will surely be helpful for each and everyone who are listening over here, or also for all those who are already dealing with the most crucial time, I hope. So doctor, would you like to give some closing comments to this session which is breaking the news?
So, just as we discussed, take time, don't rush when you're talking to your patient. Give them time to ask questions, give them time to absorb. and have an effective communication and keep the communication lines open. That's most important. Even after the treatment is over, or even during treatment, your patient should come back to you and say, "Sir," it's like you say, right? When your child is growing, you say, "I don't want my son to come and tell me anything and everything. I want him to have that rapport with me." So that's what your patient should come and tell you. They should not be scared of you. They should not shy away from you. They should have the communication lines open. So these are some small things. It's an art which we will learn over a period of time. But more importantly, the spikes model is a beautiful model for us to follow. And let us understand that in the game of, or in the whole, this one of treating cancer, this plays a very important part.
So, like listening to your speech today, like the breaking the bad news, in fact, it should be nomenclatured as breaking the good news in a right way. That word will be more suitable for this session, Doctor. So, thank you all us for joining us today. So, just one small information, stay informed, stay healthy from cancer. Thank you, everybody.